Want to welcome everyone this evening to our program. This is a program for our Psi Upsilon chapter of Sigma. So welcome to all members and non-members. My name is Laura Simmons, and I'm the president of our chapter. And we're very glad to have you here this evening in a busy holiday season. So I know sometimes it's hard to find the time. So we do appreciate everyone being here. And so I will go ahead and introduce our speakers for this evening. The title of our program is Nursing Informatics, and we have some really excellent, well-credentialed speakers. So I will introduce those and then turn the program over to them. And also, before I begin, I do want to thank Dr. Lisa Linville, who is the chair of our program committee in our Salon chapter, and she does a wonderful job finding expert speakers and programs. And so I do want to thank Dr. Linville for her time and energy for this as well.
Thank you, Laura.
Thank
It's always a pleasure.
you.
And thank you to our NI team for being with us tonight and providing the presentation. We appreciate you.
So, and again, we are fortunate to have tonight to have four wonderful speakers. Our first speaker is Tammy Peters, and Tammy began her career as a network operations coordinator of a private financial firm. And she was part of the design of operational and technical infrastructure and providing multi-site education, training, and technical support to employees and to clients. Tammy then attended Northern Illinois University for her BSN and her MSN from Walden University. And she's continued her nursing career as a clinical educator and instructor at Western Governors University. So we're glad to have Tammy. Another one of our speakers, Dr. Joellen Workman. Dr. Workman is an instructor at WGU in our MSN Nursing Informatics program, and she's also taught in our core course in the MSN program. She's been with WGU for over 6 years and has been in nursing for over 25 and has taught in online learning environments since 2009. Joellen has her doctorate in business administration from Wilmington University and a Master of Science in Nursing and Health Services Administration from the University of Delaware. She is co-chair of the LSH Nomination Steering Committee and a member of our Psi Upsilon Sigma Membership Committee. Dr. Beth Gordy is an instructor in the Nursing Informatics Specialty Program at WGU and has been at WGU for 8 years. She has worked in nursing education for over 19 years, including starting 2 nursing programs in her hometown. She's worked as an EPIC credentials trainer, serving as an instructor for ClinDOT, Orders and Beacon modules, and provided EPIC Go Live support for several major healthcare organizations that were implementing the EPIC electronic medical record. So thank you to Dr. Gordy. And then our final presenter this evening is Beverly Ballard, who's been a nurse since 1996, attending Advent Health University for her BSN and her MSN in education from Western Governors University. She's been a staff nurse, charge nurse, assistant nurse manager, unit educator, and an OB system clinical informaticist. And she is currently an instructor at WGU in our nursing informatics program. So again, thank you to our speakers this evening, and I will now turn the program over to them. I will turn my camera off and share my screen. Right. So are you seeing my screen correctly, Tammy?
Yes, I sure am.
Great. Okay.
Go ahead and change slides. And then one more time, please, Laura.
Okay.
Excellent. So nursing informatics is an exciting specialty because it allows so much blending between different elements of the profession. It brings in some research, some education, some leadership, evidence-based practice. There are opportunities to work in all of these areas. Nursing informatics is truly a specialty area that will allow you to go anywhere you would like in your future. One critical element of becoming an informatics nursing specialist is that this role draws upon your own experience as a healthcare provider. Next slide, please. Do these look familiar to you? Do you remember these? These are patient charts. Think back. Do you remember what life was like in the hospital unit before the electronic health record? Picture a nursing station with 6 nurses, 2 patient care techs, 4 doctors, a lab tech, a radiology tech, and a pharmacy tech, all trying to stand in the same space at once and be productive. Many called it controlled chaos, but to be honest, I wonder how controlled it really was. Now consider that each of these professionals need to access this patient's chart. Everyone needs that one paper chart. And where is it? It's holding the doctor up as he leans on it, talking about his golf game with a colleague, and you can't get to it. Next slide, please. Then came the electronic health record. Along with the electronic health record came clinician independence. We could now separate workstations. Today, nurses can spend their whole shift right outside their patients' rooms. Multiple clinicians are able to access the patient chart all at the same time. The electronic health record offers clinicians the ability to make patient care decisions in real time with the changing environment. It alerts us to potential dangers like patient allergies or critical lab values. We're able to notify physicians of a change in patient status with a click of a button. The capabilities of the electronic health record are amazing, and we're just getting started. Next slide, please. Think about some of the peripheral technologies that integrate with the electronic health record. Barcode medication administration protects both the clinician and the patient. Vital sign monitors can automatically take the patient vital signs at assigned intervals and chart it in the electronic health record. Not only does this mechanism automatically provide the data, but the data is integrated into the other aspects of the electronic health record. Clinical decision alerts provide real-time information to allow the clinician to make more informed decisions. The CDS alert can recognize the most recent uploaded vital sign data and offer decision guidance to the clinician in real time. Imagine you're a nurse working in a hospital. For most of you, that's not much of a stretch, right? Normally, routine labs are drawn in the hospital about 5 or 6 in the morning. When you come on at 7 o'clock, your congestive heart failure patient has potassium ordered to go with the diuretic, of course. When you scan the potassium, a CDS alert pops up and tells you that currently this patient is hyperkalemic, reflective of those most current labs, prompting you to hold the potassium and recheck the patient's heart rhythm. Now consider this reflective of other meds that you are familiar with. We all have different practices. We're all more familiar with some meds than others. Think about how this could affect. What about Coumadin and INR levels? Another interesting technology is digital whiteboards. No more searching for that dry erase marker. Information in the patient's room can be automatically updated digitally from the nurse's station. These are just a couple of examples of the many advancements that support us. We live in an amazing time of opportunity and technological advancement. Next slide, please. And now I'm going to turn this over to Dr. Workman.
Thank you, Tammy. So the electronic health record is an amazing tool. However, the electronic health record does not magically exist in a bubble. The electronic health record requires creation, support, and maintenance. You have all heard the comparison of a hospital floor nurse to the center of the wheel. We are the communication center for patients, doctors, pharmacists, dietary, and multiple therapies. The nurse informaticist extends that role in that we connect IT with nurses, physicians, and leadership, just to name a few. The electronic health record requires alignment with the specific organization's workflow and processes. Informatics nurses provide that connection. If the electronic health record does not integrate effectively with organizational workflow processes, it is useless. The nurse informaticist assures organizational integration of electronic health processes. Next slide, please. You may ask, what does a nurse informaticist do? Design, test, and put into place new or modified information solutions, consult with nurses on how to set up healthcare software and hardware, analyze information systems data to improve nursing services and reduce errors, act as a translator between nurses and system engineers, analysts, or designers, create strategies and policies to introduce, evaluate, or modify healthcare technology, and develop ways to better ensure patient data security and confidentiality. Next slide. So how about it? Have you ever considered directing your career into nursing informatics? Are you comfortable with technology? Are you team-oriented? Are you comfortable using data to improve patient care and nursing practice? Are you comfortable with change? For those that answer yes, you will find nursing informatics a natural progression of your nursing career. Next slide, please. And your career progression can look like this. You can begin as an informatics nurse with on-the-job training, obtain knowledge of electronic health system through experience. You may work as a super user, an analyst, or even a trainer. You are all familiar with this opportunity. It is, hey, in your spare time, would you like to take on additional responsibilities? This is an opportunity for a deeper understanding of electronic health system at the organization. Progression to an informatics nurse with a BSN degree will provide broader NI skills and lead to roles in leadership as a coordinator or a project manager, for example. Now, progression to an informatics nurse specialist are nurses who move forward with obtaining a master's in nursing informatics. At this level, nurses place themselves in the position of leadership opportunities, increased job varieties, increased salaries, as well as job flexibility as the graduate student gains more and more in-demand skills. It is important to recognize that any of these levels in the career progression, the nurse can obtain certifications in the field. Getting a master's in nursing informatics is highly supported by the AACN, which is the American Association of College of Nursing. And it states highly skilled providers are in great demand. Nurses with advanced preparation typically enjoy more opportunities to impact the overall design and implementation of care. Nurses with graduate preparation provide direct patient care at an advanced level, conduct research, teach online and in the classroom, impact public policy, lead health systems, consult with corporations, and implement evidence-based solutions that revolutionize healthcare. To obtain a certification in the field, there's HIMSS, which is the Health Information Management Systems Society, and that's a professional network that actually offers 2 certifications. There is the Certified Associate in Healthcare Information and Management Systems, and that certification is a pathway for expanding industry knowledge for those early in their career, but also for those with more experience. The other is a Certified Professional in Healthcare Information and Management Systems. That stands as CPHIMS. And that is a certification program for experienced professionals, acknowledging and honoring their proven expertise and commitment to the field. ANCC offers a board certification in nursing informatics, and the certification recognizes nursing informatics professionals' knowledge and expertise. And now, next slide, please. We're going to transfer this over to Dr. Beth Gordy. Thank you.
Great. Thank you, Dr. Workman. So here's some examples of ways to gain some experience. You can volunteer to be a super user at your organization, inquire about joining your informatics council, join a steering, leadership, innovation, or research council, investigate being a credentialed trainer at your organization. And a credentialed trainer often teaches new hire nurses how to use the electronic record. Suggest a project for the EHR team and volunteer to work on it with them. Volunteer for a chart auditing or quality reviews. Look for and participate in research or data analysis opportunities. So depending on where you work, these opportunities may be structured differently. Rural hospitals may have opportunities in all of these areas, where large health systems or metro areas likely would have a point person assigned to each individual area to connect with. So start exploring your opportunities. Next slide, please. So there are several professional organizations you can explore and consider joining. While we'll discuss a few of them, post in the chat if you have already joined one of these professional organizations, or if you are already involved in any nursing professional organization. You can add them to the chat as well, because some of them have subgroups for an informatics specialty. So HIMSS is the Health Information and Management Systems Society, the ANIA, American Nursing Informatics Association, the AMIA, the American Medical Informatics Association, the ANA, the American Nurses Association, the IMIA, International Medical Informatics Association, the AHIMA, American Health Information Management Association, and then Sigma and Sigma Theta Tau members can join a nursing informatics community through the circle in their membership portal. The purpose of the nursing informatics community is to bring together Sigma members who are interested in discussion, knowledge sharing, and learning opportunities about nursing informatics. Next slide, please. Nursing informatics casts a wide net when looking at potential job placement positions. Doing a basic search on a job site may or may not return many results if you simply type in nurse informaticist. However, as you can see, there are a host of potential employment opportunities for a nursing informatics specialist. Here are just a few of the job titles you may see when exploring job openings. Once you know where and how to look, you'll see a world of opportunity available to you. Next slide, please. The outlook for nursing informatics specialist is bright. This is a field where an MSN degree still sets candidates apart from others. There are opportunities in multiple types of employment settings, including remote work. Salaries are strong and job satisfaction is high. There are also many opportunities for future career growth and promotion. Next slide. This is the end of our presentation, so we can open it up for questions. Nope, Laura,
Hi.
I think you're on mute.
Oh, goodness. Thank you. Turn my camera on, but so thank you. Yes, I was going to thank you for the excellent presentation. Yes, and we do want to invite questions or comments. I would love to hear if anyone that's a member of any of those organizations as well.
Hello, Dr. Simmons. This is Carol Lisk. As you all know, I have the pleasure of leading the NI faculty team, but I wanted to double check. We'll be posting this YouTube video on the chapter site. Will there also be an opportunity for members to ask questions and post it on to the chapter should they think of something later or when they're viewing it offline?
Yes, we will arrange for that. Yes, we can post it in such a way to invite questions. Yes.
Wonderful. Thank you.
This is Liza Sanchez, and I did have a question. I've been a nurse since the late 90s and have grown in my interest for clinical informatics. And I've dabbled, like you said, I think a lot of us end up kind of becoming super users or sort of training our coworkers and things like that. And I've done that along the way. I also am interested in education, and it feels like those two things tend to go hand in hand. For those of you who are now functioning as instructors in the master's level clinical informatics arena, I am interested in how important is it? Like, should the goal be, if that's maybe a place I think I might eventually want to land, should I plan to pursue a doctorate? Is that typical at the instructor level to have that doctorate degree, as well as, obviously getting your master's in informatics and maybe education?
Let's have one of our doctors answer this. As you can see, Liza,
Okay.
we have an assortment in here,
Yes.
right? I am a master's prepared with certification. Beverly is master's prepared.
Okay.
Dr. Workman and Dr. Gordy are both doctorate prepared.
Mhm.
So I would suggest let's have one of them answer that.
Okay.
This is Beth. I'll dive in. My I went to get my doctorate because I wanted to kind of go along on the line of education and online education, and many uh, universities and colleges will require you to have a terminal degree. And so in nursing, right, that would be our doctorate, or the PhD.
Okay.
My doctorate is not in nursing informatics. At the time I was doing my doctorate, I don't even know if I looked into an informatics particular program for that.
Okay.
Dr. Workman, do you have anything to add?
Sure, yeah. So, great question. I also kind of had a similar path. I knew that, like when I finished my master's, I pretty much knew like loved teaching as well, but I also worked in management, healthcare organizations, and also some different experiences, with informatics along the way, many of those experiences. But that's kind of where, with my passion for teaching and also decided to go back right away for my doctorate. My doctorate is actually in business administration because I was a lot within like leadership. But I definitely find that valuable in supporting, all my different students, and as well as gives me, a different perspective as well.
Yeah.
Again, at the time, nursing informatics, I don't think when I had started, I'm not sure how many, if there were, doctorate programs at the time for that piece of it. But I definitely, enjoyed, I guess I'd say enjoyed that process throughout it. But I think that, here we have such a great team as well that I just enjoy working with all my team members. And I think a lot of our knowledge and expertise is also, and the program that we have here at WGU is really supportive for students looking into getting into a nursing informatics field.
Great. Thank you.
Oh, you're welcome.
Lisa, this is Carol Lisk. I would also say that the terminal degree opens your opportunities to various academic institutions, but particularly when you're looking at a specialty such as nursing informatics, that real world relevant experience is crucial and critical. And when you look at the team that we have, it's very well rounded, bringing in different aspects of their experience from nursing informatics, certifications. You can always pursue a terminal degree in a non-NI field and then achieve your certification. There's just many ways to approach this. So don't limit yourself to looking at your possibilities.
Good, thank you.
Thank you. Great question. Good discussion. Are there other questions?
Hi,
And,
this is Lisa. Sorry.
oh, yes. No, go ahead, Lisa.
Yeah,
Yeah.
I'm just curious about the certification exam from your perspective as NI faculty and specialists. What preparation do you need to sit for that exam? Do you need years of experience in NI, or I guess I'm just curious about the requirements to sit for that exam.
I'll take this one. Yes, you have to have a significant amount of hours related to informatics specialty from an experience perspective, as well as over 30 continuing education hours strictly related to informatics related topics prior to being able to apply to take the ANCC exam.
Thank you, Beverly. I appreciate that explanation. Thanks.
Okay. Well, I will post this recording on our YouTube channel and in our chapter, and I will invite more questions and feedback. Again, thank you so much for being here this evening. This really was an excellent presentation, and just you provided a lot of information about so many areas with, again, thinking about the certification, and that's a great question. I'm assuming some of those might be a little different depending on the organization, but will all require those hours, and then the professional organizations are very interesting. So, so do appreciate all of this. Any other final thoughts before we end the evening?
Thank you, Laura and Lisa, for having us. We sure appreciate the opportunity.
Yes. Thank you.
Yes, thank you. Enjoyed
So,
presenting with everybody, and I hope it, ignites some interest in this as well. I think it's a great nursing informatics is just a great field and lots of different opportunities too.
yes. And I think that point that it is just continuing to grow, and it will, it will continue to be just a great field to be in with many opportunities. So. Okay. Thank you, everyone. I will stop the recording now, and thank you for joining us.
Thank you.